Kybella and why I don't use it. So Kybella has actually been a product that has been around for not so long, and the active ingredient in Kybella, deoxycholic acid, has been around for a very long time. It is used in the hospital to dissolve lipomas, and the active ingredient, that deoxycholic acid, is a bile salt. So Allergan, being the smart biochemists that they are, they decided, let's take a product that melts fat and let's take it to the FDA and get it approved. So they took deoxycholic acid, they took it from 40 milligrams and brought it down to 10 milligrams, and then blended it with alcohol. So you need to have a solvent for this bile salt to make it a liquid so you can inject it. And they got approved for the submental area. So why don't I use a product that is FDA approved for melting submental fat? It's because it's too cost prohibitive. They got a little bit too greedy, in my opinion. Anyone that you ask who has had Kybella, I guarantee at least 4 out of 5 people bought it on a Groupon. They thought, oh, I can get this one treatment. It'll make all of my fat go away. I'm the best jawline. It'd still be like $1,000 to get a treatment of Kybella on Groupon. They got maybe 2 vials and they had a little bit of result, but they still needed more and didn't want to spend that money. Why would one treatment of Kybella not give you the results you wanted? Here's why. When you order Kybella, you get it in little 2 ml vials. So every single ml of Kybella, and this is public knowledge, easy to Google and find this out, has 10 milligrams of deoxycholic acid. So every vial that you get only has 20 milligrams. This is what we get from specialty pharmacy. When you go to a compounding pharmacy to order your PCDC, you get it in these 30 ml vials and it's 40 milligrams per ml. So imagine 1 ml is equal to 2 vials or 4 mLs of Kybella. So we can kind of write this out because when you're first learning about it, it's a little bit confusing, and I had to kind of do the thing where I sketched everything out to figure out how this made sense to me, because you just think, how is this possible that I'm ordering all of this product for less than the price of 1 box of Kybella and yet could treat 15 people? It doesn't make sense, right? It just seems like crazy that Kybella would be so much more expensive. But that's why I think it hasn't been successful. If Kybella was in a range where it was, yeah, maybe expensive, but not so expensive, and people saw really great results, it'd be all over the place. Everybody would be doing Kybella, but you don't really see it around that much. You'll kind of hear about it here and there, but you really don't hear about it that much. You know, it's not the buzz on the street. And we know that anything that melts fat, people love. So if it worked really, really well, everybody would have it. Everybody would be doing it, and it's not there. And so the simple reason that Allergan, now AbbVie Pharmaceuticals, made Kybella so expensive while making it so weak and only able to order in very small vials, that you just literally can't offer it to your clients, because even at the steepest discount where your profit margin is maybe $100 a vial, they're still going to need 8, 10, 12, 16 vials. Who can afford that? If you're charging, let's say you're charging $500 a vial, which is really, really low for Kybella, and you're going to tell someone that they need 12 or 16 vials, they might as well go have surgery done or liposuction. So here is the answer. I've had so many people ask me about this. It took myself a while to kind of figure out and trust it and talk to the pharmacist and make sure that I was giving my clients what they were asking for. But now, years later, I'm very confident and I can share with you how it works, why it makes so much more sense, and why you should be ordering it, not Kybella. Here we go. So PCDC is simply the acronym for phosphatidylcholine and deoxycholic acid. Deoxycholic acid is your active ingredient. So it comes as 40 milligrams per ml, and then 50 milligrams of phosphatidylcholine to blend it and make it a liquid so that you can inject it. You do order it per person. It is a sterile container, but as long as you're withdrawing with a sterile needle, you can use it for more than one person. Oregon State Board states that we have to throw it away after 28 days of it being open. So you do need to have a date on it once you do pop this top and you puncture it for the first time. In this, you have way more than what you would need for one person for submental. Now, if I'm doing the body, if I'm doing the thigh, if I'm doing around the bra straps, or I'm doing like upper legs, inner thighs, we will use the full 30 ml. But the nice thing is that doesn't put you over what your maximum dose for deoxycholic should be. So the maximum dose is 4,500 milligrams. So you can see that with 30 milligrams at 40, you're not going to be even close to your maximum dose. What happens when you get a little bit closer to that maximum dose? You're going to have a much higher risk of being nauseated, having a headache, feeling dizzy. And I know some people people who have had those symptoms just from talking with other injectors, whether they've tried to give themselves the maximum dose because they want to do so many areas at one time, or they push the limit a little bit on someone they've treated. Certainly we don't want our patients to be feeling that way, and nobody wants to feel so miserable they're contemplating going to the hospital, right? So I don't get even anywhere close to the amount. The most I will ever do at one time is 30 mLs, and we have never had a problem. When we're going to do the submental area, I stick to 5 mLs at the most. Body areas, we do the whole bottle. You can call a specialty pharmacy. You can go to a compounding pharmacy in your area. Just ask them what the price is for 30 mLs of PCDC, and make sure that you get it at the 40 milligrams per ml. It's a little bit confusing because on the bottle it says 5%, and I was confused about that too. Talked with the pharmacist. For whatever reason, they put the strength of the dissolvent in there, so the phosphatidylcholine is the 5%. So you do have to ask them what the strength of the deoxycholic acid is. That's what you need to focus on when you're ordering a product. The big thing with phosphatidylcholine and deoxycholic acid is you have lots and lots of swelling. So they'll have some redness and tenderness after they have the procedure, and it's really good to send them home with a treatment card. But even more important than that treatment card is that you really line out to them. They are going to be very swollen, like nutty professor swollen. If you don't tell them that ahead of time, you really risk having a client who's very unhappy and doesn't come back. I've literally turned people away because as I've been talking to them, they say, oh, I'm going on vacation in 2 weeks, or I'm going to a wedding next weekend, or we're having family pictures in a couple of weeks. I am so careful with this because you balloon up so much. And even though most of the swelling is gone after the first week, like maybe 50% and maybe another 20% by the second week, they're still going to be puffy and just feel kind of, the area is going to be numb, and it's just not going to feel great. I really say save it for a time when there's nothing going on in your life, and even better, save it for the winter where you can wear a hoodie, a scarf, whatever, to cover up all the swelling that you're having around the face. So let's talk about how I give it. So we have the phosphatidylcholine that we've ordered from specialty pharmacy. That is our compounding pharmacy that we prefer. Of course, you're going to have the alcohol plaids to clean the area, or Purison, however you clean the skin. I do like to add some lidocaine into the product. So when we first started doing this, I would just inject it. I didn't even numb the skin, and I did not add lidocaine. It wasn't until a year or two later when I was at a conference and just talking around the table with other injectors, and they said, oh yeah, we add lidocaine to the PCDC. And I was like, why, what for? Why do you need to? And they were like, it makes it so much better. That burning, really uncomfortable feeling in the first few hours of injecting goes away when you have that lidocaine. And if nothing else, it gives them some time to be comfortable while they're driving home, so they're not hot and tender and just feeling really uncomfortable while they're actually driving. So I do now mix my lidocaine with my PCDC. When I'm giving it under the chin, I will only mix 1 ml of lidocaine, and that is sufficient. When we're doing the body, we will mix 4 mLs. So when you're doing the body, it's very easy because you'll draw up 4 mLs of lidocaine and inject it into the entire bottle of PCDC, and then you can use 10 ml syringes to draw up the product, and then you can administer it, and it's really easy. When I'm doing it for just the submental area, I will draw it up in a 3 ml syringe, leave a little bit of room, and just pull up a little bit of lidocaine, and then pull back a little bit of air in the syringe, and just rock it back and forth so that lidocaine can mix in with the PCDC. And then to be extra special nice to people, I will take some Septicaine, which if you've been here training with me, you know that I use Septicaine. We made an account with Darby Dental, and we were able to get these really cute Septicaine vials. They're super great because you use them up quickly. You don't have to worry about wasting any lidocaine. They have epi in them, and they're nice and strong because it's 4% versus 2. So I always use this for numbing my cannula site. So when I'm doing the submental area, I'll always ask them if they want some up on the jawline. Most people, when you give them the option to thin out their jawline a little bit, will take you up on that. So I'll just draw from the corner of their mouth back, and then we're going to come down just a little bit. If you look at the instructions for Kybella, you only are supposed to go in this area, but any area that you can squeeze some fat, that's an area that I will inject. The one thing you have to be very careful about is their mental nerve. So I always block this off by just reminding myself that I'm not going to go anywhere close to there. If you do injure the mental nerve, it will repair itself within 6 to 8 weeks, but that's a long time for someone to wait for their smile to come back, and they will be very lopsided there. So I just kind of mark off that entire area and just leave that, and I don't touch it. And then you have the area right underneath their chin here, and we go and do the other side. So when I'm numbing, corner of the mouth back, and then we'll come under here. Most people have some extra fat pretty much down to about there. And then what I'll do is I'll just numb here, Of course, we have to be careful of this area. And then I'll numb like right through here. So using a cannula, you can go under the skin and just lay down the product. If you don't feel comfortable with that, you can do little drops all over, but it's just a lot of trauma that you don't need to do. And under here, you can just come and just make these like strips of product. So you inject, lay your cannula down, and then just withdraw and lay just little droplets of the PCDC and the product everywhere. So we're not doing anything in the chin, and we're not doing anything around that mental nerve that comes out right through here. But all the way under here is great. Now, you want to be careful. They always say leave a little bit of space from the jawline, and I believe they do that just because of that mental nerve. You know, worried that that will seep up there a little bit, but I'll go, you know, I'm holding and squeezing the skin while I'm doing it, so I'm never going up on the jawline. I'm just creating lines right through there. So let's talk about how we deliver it. You can draw it up in the 3cc syringe. I don't know about you, but I have a lot of extra needles sitting around because I don't often use the needles that come with the filler. I'm using cannula so much. I have so many of those extra needles. So a 27 gauge or a 30 gauge needle works perfectly if you want to do just little droplets in the skin. And if I'm doing little droplets, it's a little bit harder. I will be honest, it's a little bit harder in a 3cc. You might want to start with a 1cc syringe as you're getting used to distributing the product throughout the face. So if you have, like we drew on Megan, we had one area here, we had the area under her jaw, we had right under her chin, and then an area here and an area here. So when I first started, and not a bad idea, take 5 ml syringes. So it's really easy to be like, okay, I'm going to do 1 syringe here, 1 syringe here, and you can just lay it out. It's a little bit trickier when you put everything in a 3, because for the base, you would have 2 of these, and then you have to just really watch your product and make sure you're not putting too much in one area. So it depends how comfortable you are with the syringe and with the product. But if you're doing the 1 ml syringes, you're going to do 0.2 for each injection. So imagine if you have a 1 ml syringe here, you're going to do 0.2, 0.2, 0.2, 0.2, and 0.2. If you're doing it by cannula, which I like the 25 gauge 2-inch because it just fits that space perfectly, you still have to watch so that you're essentially doing the 0.2, 0.2, 0.2, and then you can go up a little bit higher and do the 0.2 and 0.2. With the cannula, you just have to be a little bit more focused on the amount you're giving because it goes in so easily. If you're doing the injection points, then it's a little bit easier to see exactly how much you're doing, but you know, it's more painful to the client. Then you definitely want to do topical numbing. Again, I didn't do topical numbing. I didn't do lidocaine. I didn't do anything when I started giving this. And I will tell you, our clients are way happier that if we're going to do injections, we're topically numbing and giving them ice. And if we're going under the skin with cannula, which is so nice because it's basically pain-free besides where you put the little drop of septicane and go underneath, they're just so much more comfortable. I always tell people, you're paying for an active ingredient. It is activating as soon as we inject it. So it's going to be normal that they're going to start feeling hot. Their skin is going to get warm. Their skin's going to get red. They're going to start swelling right away. So by the time you finish one side and then you go over to the other side, they are going to say, oh my goodness, like I'm starting to swell, like, is it starting to work? Their anxiety starts increasing, their heart rate starts increasing. You can see kind of like, the scare in their eyes. And it's like, no, this is totally normal. You were putting in an active ingredient that is starting to work the second we inject it. And that's the true benefit of mixing the lidocaine in. So once I've given the product either by injections or by cannula, and that's the same if we're doing belly, we're doing the back of the arms, we're doing thighs. Once I get it all placed, I'm taking a lotion or an arnica gel and I'm massaging for about 5 minutes. So very similar to how we do Sculptura, because I want to move that product. So either, you know, we've deposited it as little boluses or we've laid down a line in a strip of product. You want to massage that product, get through as much area in that skin as possible. And I tell them to keep massaging it. Now they're going to be pretty tender that night, and the next day they can massage lightly. And then as that tenderness goes away, some of the numbness sets in, because many people get numb from this. That's completely normal. All of that feeling will come back, but as that numbness sets in, then they'll be able to do a little more massage. The massage also helps with lymphatic drainage, so it helps some of that swelling dissipate a little bit quicker. So that's a great thing to do. What about ice? What do we do about ice? Some people say, yay, yes, absolutely you can use ice. Other people say absolutely not. And the reason is that this is a chemical reaction that's happening in the body. So if you put ice to a chemical reaction, it's going to slow down or stop it. So I always tell people, here's the deal. If you're very uncomfortable and you need to use ice for the first day, or you're just swelling way more than what you're comfortable with, that's fine. You can use some ice. It'll help calm it down. Just remember, when you use ice and you cool the chemical process that's happening, you are actually slowing down the effectiveness of the product. So keep it in mind. And usually when you explain it that way to people, they're like, oh, I want this to be effective as possible. So they'll really limit, putting cold things on their face. Otherwise, they're going to be packing their face in ice because they're going to be uncomfortable. But the second thing I tell them is take some Tylenol when you get home. For the first day, they're going to feel a little bit of that pulsating like discomfort, right? Taking some Tylenol helps a ton. Third thing I tell people do, also very important, is take something to help them sleep the first few nights. Usually they don't need it beyond the second night, and this could be some Benadryl or melatonin or whatever people use to help them sleep, because what I've heard time and time again is they go home and then they lay in bed and their face is just throbbing. So research has shown that this product is active for 12 weeks. They will feel by week 6 that all of the benefit they've received, it's all gone. But we know from multiple studies internationally that this continues to work for 12 weeks. So someone who has a good amount of fat to get rid of, you do want to do 3 to 5 treatments still, even with the PCDC. What is the time interval that you give it? I always give it at 6 weeks. So I imagine it's peaked and now it's starting to drop off. So now I want to inject that active ingredient. So you have product that is breaking down and becoming less and less effective, but still a little bit active, and then put your fresh product in. So we're always layering at that 6-week mark. When you've done your last treatment, you're going to timestamp that and you're going to take pictures 12 weeks afterwards. It needs to be a full 12 weeks after. Another main question I get is, once these fat cells are gone, are they going to come back? So no, once fat cells are broken down and eliminated from the body, they cannot come back. However, you can have fat cells in that area grow. So if you get rid of the big fat cells and then, whatever people are doing to take in extra calories, they're taking in excess amount of extra calories. If there are still fat cells in the area, they can then enlarge and grow. This is the product that it's not as guaranteed as your Botox. It's not as controllable as filler. It absolutely breaks down fat. We know that it does, but you can't really say how effective it's going to be on one person to another, what the results are going to be. So I don't recommend ice, Tylenol, and then something to help you sleep, and then not comparing results from one person to the next. It's as good as they're doing and taking care of themselves is as great as results as they're going to have. So try to be really open and honest. Super, super important to talk about the consent, and we have our own consent. We're happy to share with you guys here. It is not FDA approved, okay? And it's important for you to say that. It's very hard to get malpractice insurance coverage for this because it's not FDA approved. So this is something you have to decide if you want to carry or not. But I am very open and honest with people why it's not FDA approved. Kybella is. Happy to give that to them, but it's going to cost them 15 times as much, if not more, to do Kybella for the exact same ingredients, just because Allergan paid to push that through the FDA. This is a product that's been around for a very long time, used internationally, just no one's ever paid to push it through the FDA. So it's up to you if you want to use it, but if you decide to use it, you need to be very specific that this is not an FDA approved product and that you've gone through the full consent with everything and explained. I take this time to explain to everybody what the product is, what the history of it is, what Kybella is, and make sure they're making an informed consent. And if you also tell them about the possible side effects and you don't go even close to the maximum dose, you'll be just fine. And people will tolerate just fine. Okay, so we have our informed consent right here, and then we do our own charts, which I think most of you do make your own charts. We try to make it very simple, and we have checklists that kind of remind us of what we need to do as far as assessing the submental fullness or other areas in the body. We also talk about other treatments they could do, and then we go through how we mix it. And we even put on our sheet, hey, if we're doing submental, we're adding 1 ml of lidocaine. If we're doing the body, we put in 4. So we put little reminders in our charting so that if we haven't done it for a month or 2, you can pull out this charting and you know exactly what you do, from cleaning the skin to numbing the injection sites to massaging with arnica afterwards to giving them the post-care instructions. So you just have your own little reminder sheet right in with your own charting and keeping it very simple and very clear. So there you go. Find a compounding pharmacy that you can work with. Talk to the pharmacist. A lot of the pharmacists are very friendly and happy to help. So make your neighborhood compounding pharmacy your friend, and then integrate it into your practice. Throw some sales out there, try it out, see what you think about it, and